There are several factors that can cause infertility. Probably the main ones, about 3 or 4 main causes of infertility. An important cause is ovulation problems, sometimes referred to as Polycystic Ovarian Syndrome, various other conditions that lead to irregular ovulation. And these are an important cause of infertility, and in fact are one of the easier ones to treat of all the different causes that we have. And probably about 20% or so of couples have an ovulatory problem as a cause for their infertility. Probably the most common ovulatory problem is Polycystic Ovarian Syndrome. That's a constellation of symptoms that includes irregular ovulation, usually what we call hyperandrogenism, which is a fancy word for elevated androgens in the blood, such as testosterone, which tend to cause this condition to perpetuate itself. And that's a very common cause of infertility and ovulation problems. Tubal problems are also an important cause of infertility. The tube can be blocked at the beginning, it's called Proximal Tubal obstruction, or it can be blocked at the end due to typically an inflammatory process or an infection, which forms a hydrosalpinx, which is an enlarged fallopian tube filled with fluid. The tube gets blocked because of scar tissue that forms at the end of the tube as a result of an infection. So tubal factors are another important cause of infertility that often require in vitro fertilization, especially if surgery fails. The uterus is obviously an important part of reproduction. The fertilized egg reaches the uterus and has to implant in the uterus. For that to occur, the shape of the uterus and the lining of the uterus has to be normal. Factors such as fibroids or polyps within the uterus can impair implantation and lead to infertility or recurrent miscarriage. Endometriosis is common. It occurs in many women of reproductive age. And what in fact is occurring is that normally in a menstrual cycle, the blood leaves the uterus through the cervix into the vagina. With endometriosis, the blood goes backwards from the uterus into the fallopian tubes, comes out the end of the fallopian tubes and begins to implant on areas such as the ovaries or fallopian tubes. As a result of this, scar tissue can form, which could affect the tube and the ovaries. So endometriosis, although it's very common in women of reproductive age, it often causes symptoms such as painful periods and painful relations, and sometimes causes infertility. Approximately 20% to 50%, depending on studies that you read, of fertility is related to a sperm problem. The message is it's extremely common. It's a popular misunderstanding that infertility is related to the female, but in fact, a good part of the time, it's related to sperm problems. And the common conditions that we see are low sperm count, low motility, a high percentage of abnormal forms. Whatever the cause, there's usually treatment. And the treatment is quite variable depending on the severity of the problem. From something simple like intrauterine insemination treatments to something more complex like in vitro fertilization with intracytoplasmic sperm injection. So male factor, sperm-related problems are extraordinarily common and should be evaluated early in the evaluation rather than later. Couples have difficulty accepting that their infertility is unexplained, and I think it's very important that the physicians spend a lot of time in really explaining what unexplained really means. Unexplained means that we have limitations on our testing available today to diagnose every cause of infertility. To give 2 simple examples, the process of fertilization, we have no test for, which is obviously a very important part of fertilization. We can tell you the sperm look okay, we can tell you that a person is ovulating, but can the sperm and egg meet? No. That's just one example of the many areas of infertility that we cannot diagnose based on the testing that we use. So a couple should feel reassured by one thing, that the outlook with treatment is best with unexplained infertility, which in fact is the bottom line. The bottom line is, what is the chance of us being successful with fertility treatment in general. If I had to choose myself which factor affected my infertility, it would be unexplained, because we know that it has the best outlook with treatment.